Section 53 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 4, by Henry Gray. Accessory Organs of the Eye, Part 1. 1C3. The Accessory Organs of the Eye. Organa Oculi Accessoria. The accessory organs of the eye include the ocular muscles, the fasciae, the eyebrows, the eyelids, the conjunctiva, and the lacrimal apparatus. The ocular muscles, musculi oculi. The ocular muscles are the levator palpebri superioris, rectus medialis, rectus superior, rectus lateralis, rectus inferior, obliquus superior, obliquus inferior. The levator palpebri superioris is thin, flat, and triangular in shape. It arises from the under surface of the small wing of the sphenoid, above and in front of the optic foramen, from which it is separated by the origin of the rectus superior. At its origin it is narrow and tendinous, but soon becomes broad and fleshy, and ends anteriorly in a wide aponeurosis which splits into 3 lamellae. The superficial lamella blends with the upper part of the orbital septum, and is prolonged forward above the superior tarsus to the palpable part of the orbicularis oculi, and to the deep surface of the skin of the upper eyelid. The middle lamella, largely made up of non-striped muscular fibers, is inserted into the upper margin of the superior tarsus, while the deepest lamella blends with an expansion from the sheath of the rectus superior, and with it is attached to the superior fornix of the conjunctiva. Whitnell has pointed out that the upper part of the sheath of the levator palpebri becomes thickened in front and forms, above the anterior part of the muscle, a transverse ligamentous band which is attached to the sides of the orbital cavity. On the medial side it is mainly fixed to the pulley of the obliquus superior, but some fibers are attached to the bone behind the pulley, and a slip passes forward and bridges over the supraorbital notch. On the lateral side it is fixed to the capsule of a lacrimal gland and to the frontal bone. In front of the transverse ligamentous band the sheath is continued over the aponeurosis of the levator palpebri as a thin connective tissue layer, which is fixed to the upper orbital margin immediately behind the attachment of the orbital septum. When the levator palpebri contracts, the lateral and medial parts of the ligamentous band are stretched and check the action of the muscle. The retraction of the upper eyelid is checked also by the orbital septum coming into contact with the transverse part of the ligamentous band. The 4 recti arise from a fibrous ring, annulus tendinus communis, which surrounds the upper, medial, and lower margins of the optic foramen and encircles the optic nerve. The ring is completed by a tendinous bridge prolonged over the lower and medial part of the superior orbital fissure and attached to a tubercle on the margin of the great wing of the sphenoid, bounding the fissure. 2 specialized parts of this fibrous ring may be made out: a lower, the ligament or tendon of Zinn, which gives origin to the rectus inferior, part of the rectus internus, and the lower head of origin of the rectus lateralis; and an upper, which gives origin to the rectus superior, the rest of the rectus medialis, and the upper head of the rectus lateralis. This upper band is sometimes termed the superior tendon of Lockwood. Each muscle passes forward in the position implied by its name, to be inserted by a tendinous expansion into the sclera about 6 mm from the margin of the cornea. Between the 2 heads of the rectus lateralis is a narrow interval, through which pass the 2 divisions of the oculomotor nerve, the nasociliary nerve, the abducent nerve, and the ophthalmic vein. Although these muscles present a common origin and are inserted in a similar manner into the sclera, there are certain differences to be observed in them as regards their length and breadth. The rectus medialis is the broadest, the rectus lateralis the longest, and the rectus superior the thinnest and narrowest. The obliquus oculi superior, superior oblique, is a fusiform muscle placed at the upper and medial side of the orbit. It arises immediately above the margin of the optic foramen, above and medial to the origin of the rectus superior, and passing forward, ends in a rounded tendon, which plays in a fibro-cartilaginous ring or pulley attached to the trochlear fovea of the frontal bone. The contiguous surfaces of the tendon and ring are lined by a delicate mucous sheath, and enclosed in a thin fibrous investment. The tendon is reflected backward, lateralward, and downward beneath the rectus superior to the lateral part of the bulb of the eye, and is inserted into the sclera behind the equator of the eyeball, the insertion of the muscle lying between the rectus superior and rectus lateralis. The obliquus oculi inferior, inferior oblique, is a thin, narrow muscle placed near the anterior margin of the floor of the orbit. It arises from the orbital surface of the maxilla, lateral to the lacrimal groove. Passing lateralward, backward, and upward, at first between the rectus inferior and the floor of the orbit, and then between the bulb of the eye and the rectus lateralis, it is inserted into the lateral part of the sclera, between the rectus superior and rectus lateralis, near to, but somewhat behind the insertion of the obliquus superior. Nerves. The levator palpebri superioris, obliquus inferior, and the recti superior, inferior, and medialis are supplied by the oculomotor nerve, the obliquus superior by the trochlear nerve, the rectus lateralis by the abducent nerve. Actions. The levator palpebri raises the upper eyelid, and is a direct antagonist of the orbicularis oculi. The four recti are attached to the bulb of the eye in such a manner that, acting singly, they will turn its corneal surface either upward, downward, medialward, or lateralward, as expressed by their names. The movement produced by the rectus superior or rectus inferior is not quite a simple one, for inasmuch as each passes obliquely lateralward and forward to the bulb of the eye, the elevation or depression of the cornea is accompanied by a certain deviation medialward, with a slight amount of rotation. These latter movements are corrected by the obliqui, the obliquus inferior correcting the medial deviation caused by the rectus superior, and the obliquus superior that caused by the rectus inferior. The contraction of the rectus lateralis or rectus medialis, on the other hand, produces a purely horizontal movement. If any two neighboring recti of one eye act together, they carry the globe of the eye in the diagonal of these directions, viz., upward and medialward, upward and lateralward, downward and medialward, or downward and lateralward. Sometimes the corresponding recti of the two eyes act in unison, and at other times the opposite recti act together. Thus, in turning the eyes to the right, the rectus lateralis of the right eye will act in unison with the rectus medialis of the left eye. But if both eyes are directed to an object in the middle line at a short distance, the two recti medialis will act in unison. The movement of circumduction, as in looking around a room, is performed by the successive actions of the four recti. The obliqui rotate the eyeball on its antero-posterior axis, the superior directing the cornea downward and lateralward, and the inferior directing it upward and lateralward. These movements are required for the correct viewing of an object when the head is moved laterally, as from shoulder to shoulder, in order that the picture may fall in all respects on the same part of the retina of either eye. A layer of non-striped muscle, the orbitalis muscle of H. Müller, may be seen bridging across the inferior orbital fissure. The fascia bulb, capsule of tenon, is a thin membrane which envelops the bulb of the eye from the optic nerve to the ciliary region, separating it from the orbital fat, and forming a socket in which it plays. Its inner surface is smooth, and is separated from the outer surface of the sclera by the periscleral lymph space. This lymph space is continuous with the subdural and subarachnoid cavities, and is traversed by delicate bands of connective tissue which extend between the fascia and the sclera. The fascia is perforated behind the ciliary vessels and nerves, and fuses with the sheath of the optic nerve and with the sclera around the entrance of the optic nerve. In front it blends with the ocular conjunctiva, and with it is attached to the ciliary region of the eyeball. It is perforated by the tendons of the ocular muscles, and is reflected backward on each as a tubular sheath. The sheath of the obliquus superior is carried as far as the fibrous pulley of that muscle. That on the obliquus inferior reaches as far as the floor of the orbit, to which it gives off a slip. The sheaths on the recti are gradually lost in the perimysium, but they give off important expansions. The expansion from the rectus superior blends with the tendon of the levator palpebri. That of the rectus inferior is attached to the inferior tarsus. The expansions from the sheaths of the recti lateralis and medialis are strong, especially that from the latter muscle, and are attached to the lacrimal and zygomatic bones respectively. As they probably check the actions of these two recti, they have been named the medial and lateral check ligaments. Lockwood has described a thickening of the lower part of the fascia bulbi, which he has named the suspensory ligament of the eye. It is slung like a hammock below the eyeball, being expanded in the center, and narrow at its extremities, which are attached to the zygomatic and lacrimal bones respectively. The orbital fascia forms the periosteum of the orbit. It is loosely connected to the bones and can be readily separated from them. Behind, it is united with the dura mater by processes which pass through the optic foramen and superior orbital fissure, and with the sheath of the optic nerve. In front it is connected with the periosteum at the margin of the orbit, and sends off a process which assists in forming the orbital septum. From it two processes are given off, one to enclose the lacrimal gland, the other to hold the pulley of the obliquus superior in position. The eyebrows, supercilia, are two arched eminences of integument, which surmount the upper circumference of the orbits and support numerous short, thick hairs directed obliquely on the surface. The eyebrows consist of thickened integument, connected beneath with the orbicularis oculi, corrugator, and frontalis muscles. The eyelids, palpebri, are two thin movable folds placed in front of the eye, protecting it from injury by their closure. The upper eyelid is the larger and the more movable of the two, and is furnished with an elevator muscle, the levator palpebri superioris. When the eyelids are open, an elliptical space, the palpebral fissure, rima palpebrarum, the angles of which correspond to the junctions of the upper and lower eyelids, and are called the palpebral commissures or canthi. The lateral palpebral commissure, commissura palpebrarum lateralis, external canthus, is more acute than the medial, and the eyelids here lie in close contact with the bulb of the eye, but the medial palpebral commissure, commissura palpebrarum medialis, internal canthus, is prolonged for a short distance toward the nose, and the two eyelids are separated by a triangular space, the lacus lachrymalis. At the basal angles of the lacus lachrymalis, on the margin of each eyelid, is a small conical elevation, the lacrimal papilla, the apex of which is pierced by a small orifice, the punctum lacrymale, the commencement of the lacrimal duct. The eyelashes, cilia, are attached to the free edges of the eyelid. They are short, thick, curved hairs, arranged in a double or triple row. Those of the upper eyelid, more numerous and longer than those of the lower, curve upward. Those of the lower eyelid curve downward, so that they do not interlace in closing the lids. Near the attachment of the eyelashes are the openings of a number of glands. The ciliary glands, arranged in several rows close to the free margin of the lid. They are regarded as enlarged and modified sudoriferous glands. End of section 53. Recording by Leanne Howlett.